I was like, oh, this is interesting. And, it's something, health area that, I want to go into is the medical field. And I was like, you know what, medical assistant that kind of goes along with nursing, and it'll kind of give me a backbone, an upper hand for when I do go in the nursing program. Just the education in the medical assistant program will benefit me tremendously when I go into nursing. Kind of the breakdown with the program. So for the fall, we get our fundamentals. We learn medical terminology, we learn body structure and function. That's like a pre-anatomy and physiology class, you could say. An intro to health occupations, so kind of learning the dress codes, like how to be professional in a work environment as a CMA. Then you also take disease processes, learning what pathogens are, bacteria, all those kinds of things, pharmacology, and we take EKG class. It's a lot, but it's all interesting. And the way it's set up, it helps because they go hand in hand. Like, we'll be learning about cardiovascular disease, for example, and then in pharmacology, we go over cardiovascular medications. So it really goes hand in hand with one another. So in the summer, we do clinicals. That's when we get like the real hands-on experience. We'll go to an office, a doctor's office or a hospital. We're basically shadowing and getting hands-on experience being a medical assistant during the summer. Other people that I have spoken to, or when they ask about like what program that I'm in right now, they kind of think that it's all kind of paperwork and just kind of the business side. Like, you're the one that does like the Medicare or like, insurance stuff. And you do some of it, but you really do get personal with your clients or patients that come into the office. Like, you get to know them. You get to, figure out what's going on, help them understand their medications that are taking, just help them, get the referral so they can see a specialist if they need to see a specialist. We help them as much as a nurse will do. So I believe, for example, like EKGs, you can assist with. I believe as well giving like vaccines or shots, taking vitals, temperature, getting down the patient's information too on like medications or what their kind of complaint is, why they're coming in today. I feel confident. My professor, Anne-Marie Kirchman, has been amazing through this whole process and really been helping us get through this program and making sure, that we know the stuff. It doesn't matter. She's not about getting through it and getting it done. It's more, let's take our time and make sure we know this, because we're dealing with people's health. Like tips for people, having a lot of communication with your professor. I think that you have to have some type of communication and, let your professor know, like, I'm struggling or I'm having a hard time, or if you can go back and explain this to me, or, maybe give me recommendations on how to study a different way, because without that communication, you're just going to struggle. And having study groups with your classmates also help. I tell people, honestly, if they're like unsure if the medical field is really for them, I kind of recommend them doing the medical assistant program, because that kind of gets their foot in the water to see, is this something I'm going to like, or is this something I can do, or it's really not my forte. Let me go and do something else.